Hello, I am Dr. Ratan Jha, a senior consultant nephrologist in Hyderabad, currently practicing in Care Hospital, Banjara Hills, as a senior consultant, nephrologist and transplant physician. I have 30 years of experience in this field of nephrology, and I'm going to talk about, in a simple term, the management of kidney stone as we see in our day-to-day practice. Kidney stone, as we understand in local language as kankara pattar, or in English vernacular we say solid material which is just like a pebble which forms in either one kidney or both the kidneys and present with some discomfort in most of the situation. Kidney stone or in a medical term when you talk about renal stone is a common disease which is seen to affect almost 10% of population in the adult age group. And this prevalence is almost equal to the 10% population in the world who suffers from chronic kidney disease. That is to say that it's a common kind of problem, and we need to have some idea about this disease, how do they present, what can we do to prevent it, and how it is treated in a general sense. Kidney stone is increasing in its prevalence because of three factors. One is our dietary factors have changed, that we are now becoming more and more Western in our approach. We are taking more and more fast food, which contains a lot of salt. Second thing is that because of global warming, we are losing a lot of fluid, which is also contributing to the increased prevalence of stone. And third thing that I notice is that there's increasing prevalence of diabetes, because India has now become a capital of diabetes, and this is said to be one of the important risk factors which is associated with obesity as well as increased risk of stone. So these are the 2 or 3 things which have changed over time, and hence the kidney problem because of stone disease is also increasing, and we need to have some idea about how to take care of it. The patients who develop kidney stone are having this problem because of 3 factors. Because we know that whenever a kidney is filtering, which is said to be a very, very efficient washing machine, it tries to filter the blood in a way that it produces urine which contains a lot of substances which has to be excreted. So the urine is basically a kind of a fluid which has some solute component, which is the kind of electrolytes and many other things, and a solvent component which is in the form of water. And there are certain other factors which try to keep this solvent in a proper kind of composition so as to prevent the stone to form, which is called inhibitors. So the stone can be formed in the kidney when the solvents is less in amount, that is we're taking less amount of fluid, or when the solute is more, that means there are a lot of chemicals like salt and other kind of things like uric acid and many other things which can produce stones are in higher amount, like oxalic acid in the urine. So either in excess of salty components, or reduction of the fluid component, or the absence of the things which try to inhibit the stone to form, like citrate and many other kind of things are there which are called inhibitors of stone formation. So a person can develop stone if there is increased amount of salty substance, or decreased amount of solvent substance like water, or there's a kind of lack of inhibitors which try to prevent stone formation. This is a simplistic way, which practically is the way to look at, so that we can guide the patient the therapy that we give, how to reduce the salty component, how to increase the solvent component, and what are the inhibitors which can be given to prevent the stone to form. So this is the basis of drug therapy. The symptoms, if we look at it, many patients who are detected to have stone have no symptoms. They are accidentally found to have stone on a master health checkup. But most of the patients who come to doctor are having a vague symptoms or very clear-cut symptoms of stone, which could be a mild pain in the back or a severe pain with vomiting radiating from back to the urinary passage, which is called a renal colic. This may or may not be associated with blood in the urine, which we call as red urine. So this may be there, may not be there, and many times patients have symptom of going to urinary toilet repeatedly because they are getting a kind of urge to pass urine, which is called the frequency, a painful kind of voiding that is there. So these may be the symptoms. Asymptomatic, incidentally detected, to symptoms of mild discomfort, to severe pain associated with vomiting and hematuria. And if the patient has some kind of obstruction or diabetes, there's always a risk of developing infection, which can present with an associated symptom of fever and chills. One has to understand that the patient of kidney stone may not have any infection, and they may not require any kind of antibiotic therapy by itself for stone management. So the diagnosis of this stone is based on the symptoms, pain, on hematuria, and based on the investigations. The common investigation that we do when we suspect stone is to have a urine examination to see is there the presence of microscopic hematuria, because many patients who may not have a clear-cut red urine will have always, in 90% of times, a presence of lot of RBC in the urine when they are symptomatic. So urine, we do urine examination, we check it basically for hematuria and presence of any pus cell or any suspicion of urinary tract infection. The diagnostic test that we do is either a CT scan of the abdomen, which is said to be the kind of most sensitive test to make a diagnosis, which is a plain CT scan, which is called CT scan KUB, that is kidney, ureter, bladder area is focused, and it is a non-contrast, without any kind of contrast we try to see. This is said to be very, very sensitive and specific, and this is said to be the gold standard to make a diagnosis of kidney stone. So when a patient wants to be 100% sure, the best test is to do a CT scan KUV without contrast. But it's a costly test, and in usual practice, you do first an ultrasound of abdomen, which gives, in most of the situation, a diagnosis of stone or suggestion of stone based on presence of swelling in the kidney. Because if a stone is formed in the kidney passage, this can produce an obstruction in the draining pipe, and that produces a kind of swelling in the kidney, which is called hydronephrosis. So 3 tests that we do normally in every patient is urine test, a blood test in the form of looking at the kidney function, urea and creatinine, and a radiological investigation, either CT scan, KUV, the best test, or an ultrasound of abdomen to see the direct or indirect evidence of kidney stone formation. The treatment that we give in a patient of stone disease are 2. One is to relieve the pain and vomiting which may be associated with it in the form of painkillers, which could be given injectables, or it can be given oral therapy, and sometimes antiemetics or anti-vomiting tablets are given because the severe pain is always associated with vomiting. The certain other medicine that we give in a patient of kidney disease to help the stone to pop with drugs which are usually given for even prostate problem, like tamsulosin or similar kind of drugs are given, which helps the stone to come out. It is said that if the stone size is less than 5 millimeter, almost 95% of stones will come out. If it is between 5 to 10 millimeter, chances of coming out is 50-50. And if it is above 10 millimeter, the stone will not come out and will require a surgical treatment if it is painful, with either in the form of laser lithotripsy, where we don't have to cut anything of the abdomen. It is done by a kind of special instrument where the stone is basically burnt by the laser machine, and the stone fragment comes out. Or sometimes the stone is too big in size, and we do a percutaneous kind of hole in the kidney area and try to remove the stone. So these are 2 ways surgical therapies are required when the stone is more than 10 millimeter in size. Barring that, we should always try to give a medical therapy to see the stone can come out. But treating stone is not only one-time affair, because the stone can recur. It is said that if a person develops stone, within 5 years, the person can develop again a stone. That 50% chance of recurrence is there, and hence a preventive therapy is required. By the time prevention, we mean that diet has to be modified. The person has to take less amount of salt, because salt is somehow linked to increased incidence of calcium excretion. The second thing that we look at in the diet is that we should reduce the non-vegetarian food stuff, because somehow the increased amount of animal protein is linked to increased amount of uric acid excretion, and it can lead to increased amount of stone formation. So we tell the patient to reduce the salt intake, not to take papa, chutney, achar, because these are simple therapies, along with reducing the non-vegetarian kind of food by 50%. And third thing that we tell them, that we should take at least 3 liters of water to produce 2 liters of urine. It is very difficult for any person to measure urine volume every day. And we tell them if the urine is looking white in color, it means that you are taking enough amount of water. It should not look yellow. So normally 3 to 4 liters of water is given depending on the climate, etc. In a cold climate, we give 3 liters of water, and in the hot climate, we give 4 liters of water, produce 2 liters of urine, because that will mean that whatever amount of salt or other substances coming in the urine is not concentrated. One simple dietary supplement in the form of potassium citrate is said to have a kind of beneficial effect in most of the stone, and we try to tell the patient to take this solution every time after food, because this is an inhibitor of stone formation, and this has to be continued lifelong. So one has to always remember that the treatment of stone is not a one-time affair. It is a lifelong kind of follow-up and lifelong kind of a disciplined behavior, because stone is recurrence is almost close to 50% in 5 to 10 years, and hence we need to be vigilant for that, and we need to continue that therapy. Other things which have been contributing to stone formation are obesity and diabetes. So it is said that persons who are overweight should try to lose weight, who are diabetics should try to control diabetes better, because diabetes is somehow linked to both obesity and increased risk of stone formation and complication, because diabetic patients, if they develop stone, there is a risk of urinary tract infection, which can lead to a kind of life-threatening problem which may require admission. And if stones are not treated well, there is always a risk of kidney damage, which may lead to a need for a kidney replacement later on. This is one of the important causes of preventable kidney failure in future, and hence we need to be aware of this problem and need to refer the patient to the right specialist for getting the right kind of care, not in the form of only a one-time affair, but a lifelong kind of advice how to prevent this stone formation. Thank you.